So now I would like to call upon workshop 1. So Dieter, please give us your report on patient journeys in cross-border healthcare, challenges and policy options.
Well, the point is that this may have happened to all the others as well. We didn't have enough time. And we identified lots of barriers, and there were so many barriers, and it was quite difficult to identify the 4 most important ones. Where we quite easily agreed is that there are financial barriers and that there is a big information problem. But there were lots of other things then as well. One is communication and continuity of care and treatment. So these were the 4 barriers we had as our priority. Then we tried to describe those different barriers. You see that over here, very often it is that travel and accommodation is not covered, and there is a delay in reimbursement, for example. Some said that sometimes it takes a couple of months till people get their money back. Our key thing, and we are really incomplete here, that is, things will have to be added. We've got several points we could not cover because of time reasons. Well, how can these challenges be addressed? You see on the EU institution level that we should encourage the member states to adopt the direct payment system. That is, it is important that not the patient waits for such a long time, as I said before. Then that monitoring and controls are enhanced. What about the member states, the regions? Well, again, also here you see the direct payment system. Stakeholders, healthcare professionals can support some cases by testifying there are exceptional circumstances. What can patient organizations do? A very key thing. That is, one thing, as it was said this morning, that is that provide information, but also that they do lobbying, and lobbying with the government and also with the national contact points. Availability and access to information. Well, patients, as we heard this morning as well, are not necessarily aware of the existence of that directive. Concerning language and information, there is the wish that things are not only available in their language, but there's also a lay version, so that it really can be easily understood. Issue 3 here, lack of delay in implementation, lack of patient involvement, also very important that patients can be active here. Well, how to address challenges, barriers? Again, you see the actions that should be taken on these different levels, on the institution level. That is, we need an education program for health professionals, a campaign to raise awareness. Then member states, regions, as it was said before, translate the directive into lay language, publicize the directive in media, inform doctors, and print access to information onto medical health card. Stakeholders, making the information easily accessible. Again, the point lay language, this reappears, you see that with patient organizations as well. And one key thing is that we should encourage the work of patient organizations. As we said, patient organizations, they give independent information. We heard this morning that sometimes national contact points, for example, are based or accompanied with health insurers, for example, and patient organizations can do that independently. Yes, communication barriers, you see, language issues, and communication between the doctors at home and the doctor abroad. This was the key point also. They said, well, what about a patient who is willing to go to another country? What about the doctor at home? Will he accept that? What will be the situation like if he returns and says, should he conceal it, or is there a way of communicating that openly? Again, the way of how to address these challenges, you see, on the EU institution level, providing translation of medical documents, then EU program for medical linguistic facilitators, addressed to stakeholders, that is, there should be a smart card to access data abroad, on the for the patient organizations trained to inform patients, and also that is lobbying that patients should be active there. Yes, you see that then we were running out of time, continuity of treatment, and there are things we have got a long list. This is what we're going to do. We'll add this, yeah. This is what we tried to fill in quickly. I think this is also what was there before.